If you are pregnant and planning on going on a cruise, there are a few things that you may want to consider before booking your trip. This is P&O's policy on their website on accepting guests that are pregnant. Firstly, your holiday must have concluded before entering your 24th week of pregnancy. Secondly, you must have a letter from your doctor saying that you are fit to travel and include your estimated due date. This letter must be produced upon request. It looks straightforward, but once you pay your money for your holiday, you will receive an email a few weeks later requesting additional, more specific information. The email says that a letter must be produced stating that the mom and baby are in good health, are fit to travel, and that the pregnancy is not high risk. The letter must include the estimated due date from both the last menstrual period and ultrasound if one was performed. This email and the use of the words high risk can cause worry for all sorts of pregnancies, including if there are multiple babies, IVF conception, and if minor medical conditions are present. I was worried because my pregnancy was via IVF, which is most often considered high risk. I didn't even know if they would refund my money if they did not accept me on board. After causing some anxiety, I was lucky that my doctor wrote me a medical certificate providing my estimated due date and that I had no medical contraindications to travel. Some other issues was finding insurance. Note that you must have insurance to be eligible to cruise. It is mandatory and a copy of the policy needs to be provided to the cruise liner. Some companies do not offer cover for pregnancy at all, and those that do often have conditions. Insurance premiums can be much higher for pregnant women than for non-pregnant travelers. I found a policy through Allianz Insurance. It was $132 Australian for a 9-night cruise. If I wasn't pregnant, I could have bought policies with other companies for about $30. It is also important to consider if the risks are worth it to travel when pregnant. Injury or preterm labor can occur when the cruise ship is far from land and immediate help cannot be received. To be honest, this made me nervous when we were far from land, as I knew help could not be easily obtained. Lastly, there were many travelers on the cruise that had physical limitations or were of age, so just a heads up that you may not receive priority or special treatment. In my experience, people would frequently push in front of me at the lifts, despite being pregnant and having a toddler in a prom. Another example is getting off the cruise. It took nearly 2 hours, which is not ideal when toilet stops are needed frequently and you have an impatient toddler. I hope some of this information has helped. Subscribe and hit the bell button to keep in touch.